So there are multiple different ways to treat alcohol use disorder. And medication is not generally the first line for treating alcohol use disorder. In general, I would say that recognition that you have an issue or a problem is the first step in addressing heavy alcohol use, problem drinking, and alcohol use disorder. So the mainstay of treatment for alcohol use disorder has been Alcoholics Anonymous. It's provided by peers. It's free. It's accessible. There are dozens of meetings going on at any one time in a major city, for example. Um, and essentially, those are very strong aspects of Alcoholics Anonymous. The 12 steps are super useful. The big book has a ton of information in it. And I think for those it's a good fit for, they can do very well. Now, some people think of Alcoholics Anonymous, though, in their experience, and they tell me this when they go, is that they're not ready to quit completely. And in fact, going from 6 or more drinks a day to 0 puts you at risk of alcohol withdrawal. And if it's 12 to 16, you may very well have a seizure. I hear that over and over again. People come to the program and they said, I knew I had to stop, so I just stopped. Well, I mean, there you have all that self-discipline, but then 2 days later, I had a seizure and I had to be admitted to the hospital. And then I went to residential and all of that. And so it's safer to cut down more slowly. And then I think also that the people who are enthusiastic about AA sometimes feel like because it works so well for them and their friends, their family, that it's the only way. And this is just human nature being what it is. I mean, these folks are very excited, well-meaning, good-hearted, but sometimes they don't necessarily see that AA isn't for everyone. And so one thing I tell people when they go to AA, if you feel like you have nothing in common with the people there, you need to go to more meetings, essentially, and you need to find a meeting where you feel socially comfortable. So I usually tell people to try at least 4 or 5 meetings, sometimes more. Now they may come away and said, okay, I found a meeting with a bunch of other upper middle class, professionals like I am, and they say, it's still not for me. It doesn't work for me. At that point, I go, you gave it a good shot. I see what you mean. And here are your other alternatives. So one of the probably best alternatives would be another outpatient modality that is run in part by peers. And that's something called moderation management, smart recovery. Essentially, there are other names for it as well, which I'm not remembering, that the approach is more based in science and pragmatic. And essentially, it is more akin oftentimes to a harm reduction model. So people can feel like they can go there and begin to learn about the data around alcohol being bad for you, both in terms of emotional well-being and physical well-being. And that will help to motivate you to drink less. They also talk about strategies for being able to do that. It's not just here's the data and go, but it's a different approach. And that sometimes helps people reduce. People sometimes have trouble with the higher power of AA. And in my mind, it certainly doesn't have to be, a religious God. It could be something else. But some people really, that part of the whole AA thing, they don't like. Now, a lot of people start their alcohol treatment in residential treatment. And sometimes there's just no other way to access stopping drinking. Unfortunately, this often comes after a DUI, which may or may not include injuries. It can happen after a divorce, can happen after an injury, an illness. And the goal always is to try to help people stop before they have such a severe consequence. So residential treatment either starts because of severe consequences, or it often starts because of a need for medical detox. So that residential treatment generally is time limited. It used to be a 28 or 30 day. Nowadays, it seems like the insurance companies want to pay based upon medical necessity, and sometimes it's 7 days, sometimes it's 14. If you're paying out of pocket, the residential treatment centers are happy to take anywhere between $15,000 and $60,000 a month from you, and you can get your full 30 days because you're paying for the service. But a lot of times residential treatment is great for getting people sober. It's the aftercare that's challenging. So there's a level of care called intensive outpatient. And essentially that is traditionally brick and mortar facilities where you would go usually 3 half days a week and have formal groups. There's usually AA involved, but there are lots of other helpful groups talking about dual diagnosis and depression or anxiety, talking about relationships and family issues as well. But that's a level of care that's helped a lot of people maintain sobriety after they leave residential treatment. So, and then you have pharmacotherapy, which, in my opinion, could be used earlier, frequently. A lot of the folks who are drinking too much comes to the attention of a primary care doctor or other specialist, can come to the attention of clergy, can come to the attention of therapists, and making a first referral even to primary care to start naltrexone is usually the most commonly, could put you on a path to drinking less and avoiding the consequences. So the advantage of a place like Ria Health, though, is that the physicians and nurse practitioners who work there, we really specialize in prescribing naltrexone and other medications. But the bigger variable is we have this whole team of certified addiction counselors, coaches, and we offer this comprehensive integrated approach of both medication integrated with coaching. Now, you can integrate medication with AA. And in fact, a lot of the people I see in the program go to AA. Fantastic. Traditional AA does not support the use of medication, does not support the use of antidepressants or psychiatric medication. That's in flux, that's changing. It varies from meeting to meeting, region to region. But I don't support that way of thinking that it's an all or nothing phenomenon. I'm a pragmatist. I kind of feel like if you can pick and choose from different modalities to help you meet your goals, that's the way it should be.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.